We can't hear you, Jess.
It was the double mute, really. After all this time, double mute. Good morning, everyone. And we have a lot of great information today. Glad you're with us. We are going to start out with a overview of COVID data currently in Missouri and some resources and information for our stakeholders related to COVID. And I'd like to introduce Leslie DeGrip. She is our clinical coordinator for the division and an RN. And Leslie, I'll let you take it from here.
Okay, thank you, Jess. I appreciate being asked to be here. It's an honor, and I'm just happy to share this information with all of you. As Jess said, I am a registered nurse, and I've worked with the Department of Mental Health in the Division of Developmental Disabilities since 2008. I've had many different roles, from working in the units to quality enhancement. And so, as she said, I'm here to talk about COVID-19 and review some data that I have on where we are in Missouri with COVID. I also want to talk about ways that we can stay safe and also offer some resources, as Jess said, so that you or someone you know may be able to use them, in case you need to get free testing or a vaccine, or just want to learn more about COVID. Google's a beautiful thing, but we do have these resources already in hand. So yes, definitely want to share that information. So I'm going to share my screen. If you'll just give me a second. Sorry, I'm a little slow here. I want to share screen. Okay, not this screen. Stop sharing. Sorry, guys. Thank you for bearing with me. Now, what Heike already had on the screen was our DMH page that does have DD-specific information related to COVID. So you can always go there and look at our different guidance and different resources that we have on that page. What I'm showing you now, and I apologize, it's a little bit grim way to start off, but it is something that's really important that I feel like needs highlighted, so we can just know how serious that this disease is, especially for people with intellectual and developmental disabilities. This data right here, it's a table that shows the number of COVID deaths per age group per month since April of 2020. The number of deaths in the younger age groups are rising according to this data. You see, there really wasn't a lot all year. Here in sort of the fall months, you had a few, but now, and then March and April of this year, you didn't really have any. But then when we get into May and look, June, there's someone 50 to 59. And then up here is what concerns me is, I mean, I'm concerned about everybody, don't get me wrong. But, we thought of this as an older person's disease, where that we really had to worry about people over 65. Well, people are passing away in the 10 to 19 group, the 20 to 29 group, and here we have the 30 to 39 group. Now, I don't want to scare you, but I just want you to know that this is serious. And the CDC has, guidelines of staying safe that we will cover. So just remember that we will cover that. I'm going to scroll down. Pardon my crude, I put it on a Word doc. This is just another way to illustrate deaths per month. See, it peaks right here at 14, and then you can see over here June, it kind of maintained at 1, and then July jumped up to 4. We've already had one in August, and it's only the 6th. So that, that's just very concerning. Let's see, I'll go to the next, scroll down to the next one. Now this illustrates the number of cases, COVID cases per waiver type since the start of the pandemic. July numbers show 127 cases, which is quite a tremendous, this is the total line right down here, but that's quite a tremendous increase from total cases. As you can see, I mean, we thought things were getting better. People were starting to get vaccinated. The cases just weren't, showing up. But now they really have surged. We are doing a lot of testing. However, there are a lot of people with the symptoms. So the testing is definitely necessary. Here in August shows six, excuse me, cases. This just kind of shows how it's all broken out with the different types of waivers that we have. I'm going to scroll on down. This is just another way to look at it, total cases by event data. And we enter this information into an event reporting system so that we can keep track and know how we're doing. And just it helps us know like where we need to send more support or resources. So that's just another way to look at that data. I'm going to scroll a little further. And this right here, I actually have a link where you can see this information if you look it up, I believe. It is, I'm switching gears a little bit. This is now a look at data related to our Missouri hospitals and how COVID-19 is impacting them. This is the current hospital status in all regions in Missouri as of August 3rd. As you can see, the total COVID-19 hospitalized patients is 2,125. Let's see, the remaining total hospital bed capacity, inpatient and outpatient, is 27%. Remaining inpatient bed capacity is 17%. So the disease and people who are ill with it are definitely taxing our hospital resources. As you can see here, this is ICU or intensive care unit, COVID-19 patients in intensive care unit. And this data was pulled on the 3rd of August, so just a few days ago, that there were 634 people in intensive care unit. The remaining ICU bed capacity, 16%. That's not very much, as you can tell. Ventilators, we have the ventilator information for Missouri. COVID-19 patients on ventilators, 347. And then the remaining ventilator capacity is 67%. And I'm going to scroll down. And the links, I'm not sure if we post links in the chat, but we can definitely get that figured out for you if you want to look at some of my resources. I'm going to scroll down to one more thing. Okay, COVID-19 hospitalizations. It's kind of, there's a lot of stuff on here. I hope you can see it okay. I'll enlarge it a little bit maybe. But the COVID-19 hospitalizations, the purple graph shows total COVID-19 patients in the hospital by day. As you can see, it starts July 1st of last year and ends in July of this year. You can see that the cases are much higher this year than last. See, there's where it starts around 1,000, and then you go up to here and it's 2,000. So it has doubled. So that's troubling, in my opinion. COVID-19 patients in ICU by day. The comparison is similar from July 1st of last year to July 1st of this year. The ICU COVID patients are quadrupled in numbers. We have 200, that this is a year ago in July. And then we come over to here to current, and it is up to 600. So that's quite a deal. I think that was my last graphic that I wanted to share with you, but I'd like to talk about, let's see here. So now that we've looked at the data, I'd like to talk about ways you can keep yourself and others safe, because that data is kind of scary, and we want to know, we don't want to be hopeless and think we can't, what are we going to do? I mean, it is a stressful time, but there are things that you can remember that you can do in order to stay safe. And what I'm going to pull up right now is the Department of Health and Senior Services. I'm trying to click on it, sorry. It's kind of going slow. But the Department of Health and Senior Services, they teamed up with the Missouri Developmental Disabilities Council to create a COVID-19 plain language guide for the disability community. it talks about what COVID is, what are the symptoms, information on vaccines, and it has other resources for if you have to stay home, things that you might need to keep in mind. It also tells about where, if you need a ride to get a vaccine, I believe it has testing. It just has all kinds of things in it, and it's put together in layman's terms so we can all read it and easily figure out what we need to know from it. And I'm going to try and click that link again. Okay, maybe I can, hang on, I'm going to do this because I just want to kind of show you what it looks like. It's a really neat document, and I'm just so happy that they made it for us. Thank you for bearing with me, you guys. Oh, I'm not able to get that pulled up. I'll keep trying here in a little bit. We'll post the link though, especially so if you guys want to check it out, it's a nice tool to have. Some of the things that it also talks about, which I'm going to just say it on here just as a reminder. And I know that our doctor, our medical director, Dr. Stanislaus, she's a brilliant woman, and she has been saying back to the basics. You know, we got to get back to the basics. And the basics, remember, wash your hands. And if you can't wash your hands, make sure you have some hand sanitizer handy. They even have those little pocket ones that you can carry. I'm sure most of you probably already do that, but that's just a reminder. It's still just as important as it has been. Wear a face covering when you go into a public place, and if you can't stay 6 feet apart. And this is one thing that I know people bring up, and I notice it too sometimes, but don't forget to cover your nose as well as your mouth when you have your face coverings on, because you're still breathing, you know, through your nose, and, you know, ejecting particles in the air and, you know, bringing particles back in. So if you have that barrier over your nose and mouth, that will definitely help. Stay at least 6 feet, which is about 2 arm lengths from other people. Cough or sneeze into your elbow or a tissue, then throw the tissue away and wash your hands. Avoid touching your face by keeping your hands busy. These measures are even recommended by the CDC for those who have been vaccinated. And I have a link for that as well if anybody that we can share perhaps. On July 27th of this year, the CDC did update their recommendations for fully vaccinated people. And stop sharing my screen for right now, just because I just realized you guys are probably just looking at a blank page. Okay. So another tool that we have available to help decrease your risk for serious illness, hospitalization, or death is, of course, the COVID vaccine. Taking the vaccine is not for everyone, and you should definitely check with your doctor if you have any concerns about taking it. However, it has been proven in most cases to be effective in preventing serious illness, hospitalization, and death. It has also proven effective against the Delta variant, which is what is surging through our population now. And I heard, this is kind of a downer too, I heard that there is a Lambda variant, and it is in South America, so that's something we'll be definitely watching for sure. Some things, back to the Delta, some things to know about the Delta variant. It is much more contagious than the original strain of COVID-19. The symptoms seem to appear right away in many cases, and often people are reporting sore throat, runny nose, and headache. You can still have all the other symptoms that have been listed, and if you need to recheck those symptoms, definitely go to the Centers for Disease Control and Prevention or the CDC website, and even on our DD homepage. So you can, you know, if something's going on, it could be stomach or diarrhea or vomiting. I mean, it's just so varied with people, but I have heard that the sore throat, runny nose, and headache has been common with this variant. So just reminding you. And if you're needing any information about getting tested for free or getting vaccinated, such as where to go, how to get to the location, the website, well, we can probably post it, but it's like Mo Stops COVID, and it gives you all kinds of information and how to help how to get help with COVID-19 testing, individuals that you're taking care of, equality or equity. It helps with seniors and homebound adults, businesses, vaccinators. They have a toolkit for if you want to share information. They also have a get a ride feature. So if you're needing a ride, you just type in your location and you can figure out a way to get a ride to go get your vaccine. And then they also have local vaccination events posted on there where people have it set up. And I think they probably have some kind of drive-through. I'm not sure, but that's just got all kinds of good information. And I want to throw this out there for you guys. I wonder if I can get on that link. I couldn't get on the other one, but let me see if I can show you this one. It might be working, and it is. It's just a real cool site. I'm going to share my screen again if I can. And thanks again for bearing with me. Kind of not very smooth here. Okay, get over here. Paper or Word doc. Okay. So this is what it looks like. And look how it says right here, enter to win $10,000. So that's totally something you could take advantage of. Go back here. So you just, if you've been vaccinated, you can click on that and enter to win. BMO VIP winner. So that's an incentive. That's just how important. And just getting a vaccine, that's just, there's scientific evidence behind it. And that just shows how important it is that, you know, they're creating a bit, you know, a lottery to help motivate people. That's definitely one way to keep people, keep the spread under control. I mean, yes, you can still get sick if you've been vaccinated, but your symptoms, for the most part, will not be as bad as if you have not been vaccinated. So it's a good tool to have in your pocket. And in closing, I want to also share one last piece of information to think about. And this is for our group. This is what we need to focus on. The Centers for Disease Control and Prevention, or CDC, has people with intellectual or developmental disabilities. They're considered a high-risk group. We have people with hypertension, other diseases, and people with intellectual and developmental disabilities. They're considered a high-risk group. And so in high risk means serious illness, hospitalization, and even death could occur if they contracted COVID. So please consider the safety measures that we discussed this morning to keep yourself as safe and just as safe and well as possible and healthy, and keep the people who may be at higher risk. So we can all of us work together to prevent any tragic outcomes, or any more tragic outcomes, I should say. So we've got these simple tools that we can use. And if we just work together, I mean, Missouri, we're going to prevail. Missourians are going to prevail. We just have to keep this stuff in mind. And I don't know if there's anything in the chat I need to be responding to. I kind of have been seeing stuff pop up. And so I'll just close with, this is the information that I've prepared to share with you today. And I thank you so much for letting me be part of your life for this brief moment on a Friday morning. I hope this information has been useful for you, and I hope that it will give you thought on, you know, how you can stay safe and keep people that you take care of safe, or we'll just keep each other safe during this pandemic. And thanks again. Stop sharing my screen.
Thank you, Leslie, for sharing all that great information. We did have several really good questions pop up in the chat, and one of them that I was not able to find an answer to right away, but I believe is being tracked at the statewide level, is the number of patients who are positive who were previously vaccinated. And I believe that is data that is being tracked at hospital admission level, but possibly not at a statewide level in general. So that's something that we can get back to everyone on at a future update. But I think, if I could point out something if I missed it, I think we've covered all of the other really good questions in the chat. So there is links in there provided to the plain language guide, to the direct link to the hospitalization data that Leslie had pulled up so that you can see the point in time as need to monitor your area. And then there was a question, a really great question about a day hab provider or any type of provider who is wanting information on testing, and including Binax Now testing. So we have an email address that goes straight to Leslie's team, and they will, and I've posted that email address in the chat. They can help you with anything you need regarding testing, getting access to testing resources, understanding how to use it, understanding, kind of talking through how often to use it based on your circumstances. So really encourage you to reach out to them and talk that through and make those decisions based on your populations. Also, there was a question about specific Delta variant symptoms, and the link to the DHSS health advisory with those specific symptoms is in the chat if you'd like to take a look at that. There was a really good question about the Lambda variant of the United States, and at this point, we do know that there are approximately 1,000 confirmed cases of the Lambda variant in the United States, and we are learning as we go on that, and really depending on our doctors here, the CDC, and Department of Health and Senior Services to provide us with updated, timely information on how we should react appropriately in order to keep everyone safe, and any changes that we should make. So if there's something in between these types of calls that comes up regarding that and how we should proceed, the division will communicate that information through normal channels. So with that, we'll take a look at some other questions in the chat as we go through this, but I am going to turn it over to Wendy, or no, I'm sorry. Next, it is Angie. Angie's going to talk about some of the flexibilities that we have in place regarding COVID. And Angie, I'll turn it over to you.
All right, thank you so much. We are going to show you a flexibility chart that we have on our website, and we have recently updated it due to the federal public health emergency extended. So on our website, you can see here the COVID-19 Flexibility Authority chart. On this, we have multiple ways of receiving flexibility, and that is through our federal, the waiver application. We also have state regulations, things like that. So Heike, could you scroll back up just a little bit? I want to make sure to show the dates at the top. So we also have 1135, which is state plan services that are kind of outside of the waiver. The federal public health emergency is set to expire on October 18th of 2021. Our state public health emergency or declaration of emergency is set to expire on August 31st. So that's set to expire before the federal public health emergency. The federal public health emergency specifically works with our Appendix K and our 1135 waiver flexibilities. In our Appendix K, it gets a little confusing here, so I'm trying to talk about it slowly here. The Appendix K flexibilities that we have that are going to be listed out in this chart, those will not expire any later than 6 months after the termination of the federal public health emergency. So right now, the federal public health emergency expires on October 18th, 2021. So any flexibility that we have listed in the column 1135 and Appendix K will continue through April 18th of 2022. If it is a flexibility that's from the state that's set to expire on August 31st, those would be listed under the column that says state, which includes the governor's declaration. So any CSR in there would expire on August 31st. So you'll see as we kind of walk through this, there's going to be some that are conflicting. We are in conversations with the governor's office just about those conflicting flexibilities. So we'll continue to keep everyone posted on where that lands. But this flexibility chart is specifically for all of Department of Mental Health. So the first section is Division of Behavioral Health. And I want to take you down to, if you don't mind scrolling down to the Division of DD, and I can show an example where we have an Appendix K authority as well as a CSR. So here's our first example. When you look at our personal assistant services for self-directed, and we've got the limitation of the 40 hours per week, our Appendix K that was approved back in May of 2020 has that flexibility. So that flexibility, according to the Appendix K, will, as of right now, be okay through April of 2022. However, at the same time, we have a state regulation that has the limitation of 40 hours per week. That right now only goes through August 31st. So that's why we're in the process of talking with departments, with governor's office about that difference that we'll have if the state emergency does not get extended. And there's a couple other in here. Heike, do you mind scrolling down just a little bit more? So here's another one. Oh, sorry. On our med administration certifications, there are flexibilities in state regulation that would expire on August 31st. But again, we have those flexibilities that would last further through to April of 2022 for our Appendix K. So everyone take a chance to look at the guidance. It's really, it's been a great resource for all of us here in the office, central office, and with even our other agencies, just because it's so complicated when we have all these different flexibilities from different areas, but it lists them out very succinctly and then where the authority lies. So just wanted to make sure everyone saw that and then really understand the differences between those end dates. And that we continue to track and monitor those closely and have those conversations so that everyone is aware of those differences. The next thing I want to update, thank you, Heike, very much. I appreciate it. The next thing I wanted to do is just give a quick update on budget items. Our team has worked really hard on implementing the rate increases that were effective July 1st through general revenue. And so that was the 5% increase to DAHAB, community integration, individual skill development, all the employment services, and then as well as our personal assistant rates to bring them up to an equal level with Department of Health and Senior Services rate study. Those all went into effect July 1st. We have those in place now. And I wanted to thank all the providers that worked with our regional offices on any of those pending billings that caused some rejections. We really appreciate your time on that. Which brings us to the next set of rate adjustments that we're going to be focusing on, and that will be group home and ISL rate standardization, as well as the 5.29% personal assistant rate increases that will be effective July 1st, 2021, once CMS has approved our HCBS spend plan that we submitted on July 12th. If you remember, the General Assembly passed through the budget to bring all group home and ISL rates up to the Mercer lower bound from the rate study, and then an additional 5.29% rate increase to personal assistant services, utilizing the enhanced HCBS FMAP funding for fiscal year 22 only. So funding will need to be determined again for fiscal year 23 for those specific rate increases. We submitted our HCBS spend plan on July 12th, and CMS indicated to all states that they would receive approval or word back from CMS within 30 days. So we anticipate hearing something back from CMS next week on August 12th. We did ask for an expedited approval for the rate increases that were passed, utilizing the enhanced FMAP, so that way we could get those in the system. When we do that, we will probably needing some provider assistance again if providers have been submitting invoices for the residential services already for the month of August. So if there's pending billings in our system, again, we'll need to work with you just so we do not have those rejected claims when we enter those new rates in. So again, we'll work with you, regional business offices and provider relations. We'll work closely with you on that. And we hope to get that cleared up as quick as possible. And then we will work with you as well to go back to clean up the July rate adjustments. We want to be very efficient in how we do that and timely. So we'll lay out a plan and share that with you. And then I do want to, since we're talking about the HCBS spend plan, I wanted to remind everyone that that is out on the MoHealthNet website for public comment through August 15th. And we really encourage everyone to take a look at it, participate in that public comment opportunity. And remember, when you review the spend plan, in order for us to spend those funds, we will need appropriation authority granted through the General Assembly. The only items in those spend plan lists that you look at that have already been appropriated, that we already have appropriation authority for, are the rate standardization and the PA rate increases that we just talked about. So once we receive that approval, we can move right away on getting those implemented in the system. Everything else will have to wait for appropriation authority, and we continue to work on decision items for that remaining spend plan components. So that is all I have for updates, and I think what I can do is go through and look to see if there's questions. It looks like some are being answered, but I can go ahead and turn it over to Wendy for her updates, and then I can work on answering questions in the chat. So Wendy?
Thank you, Angie, and thanks for going over the flexibilities first, because that really leads into just the reminder to the providers that you have the same options available to you now as you did during the first round of COVID-19, and the things that you had, tools that you had that you could do in order to protect the people in your care or make the decisions that you needed to make as an agency. All of our providers, I think, did a spectacular job in doing what they needed to do and keeping people safe the first go around. So we have utmost confidence in your continued ability to make decisions with the new variant, and throwing in the complexities of, are you vaccinated, are you not vaccinated, and all those kinds of things. I know that some people become aware of what the division has done, or decisions the division has made in regard to state operated programs. And I think it might be helpful to remember that Jess wears two hats. So the decisions that she makes as a provider on the habilitation side and for state operated programs, she makes as a provider, and doesn't translate or mean that they will become mandates that she would make as a funder for our community network and program network. That's why we try to maintain as much flexibility as we can for our providers to make the decisions that make sense for them, given the circumstances in their community, within their program, who they're serving. There's just a lot of nuances that we know have to be considered. And so sometimes you might think that decisions made in the provider side of our house might translate to mandates on the funding side and our community provider network, and that doesn't always happen. So I hope that that's helpful to kind of keep that in mind, and the two different hats that Jess wears when she's making those kinds of decisions. We will continue to make, or we will reinstitute expedited utilization review if that becomes necessary for program changes that need to be made, if programs are consolidating homes or changing, if day programs end up closing and we're needing to make service changes quickly, we will launch that program again so that we don't interrupt your business cash flow, and we get those things made and done expeditiously. So if we need to do that, know that we will be doing that again. Keep in mind that we should already be having in place, we've been through a whole year now, so everybody who has a service plan would have gone through a planning year by now. But we should have included in those service plans what individuals need to either learn or be supported to do in order to self-protect against the virus. So if someone has the capability of learning how to social distance or how to tolerate wearing a mask, those should be learning objectives in their programs. If that is not something that is expected to be a good learning goal, then it should be clear in the plan how the staff need to support people to keep them safe when they're going out in the community and they're engaging in other activities. So be sure that those things are included in people's plans. Also, just a reminder that as things change with the virus and we get new nuances that come into play, like with the vaccinations and such, that providers need to be sure to review their policies that they have in place around the pandemic and your COVID and your response to outbreaks, and make sure that they still are current, that they still make sense with the new information that we have. Be really vigilant in training your staff and monitoring. We will help in that monitoring piece when we have gone out to homes with our different monitoring units. I know there's been some people that are concerned that they're not seeing a lot of mask wearing, but we don't have any way of knowing if that is consistent with policy, if it's appropriate or not appropriate, and if it's consistent with CDC. It's going to be up to the providers to know if of who is vaccinated with the staff and the individuals served, what protocols would be appropriate in that home. But we will be asking people if they know what their policy is, what their masking policy is, if they've got PPE available to them, or how they would go about getting it if they needed some. And if they're not familiar with what those policies are, we will probably drop someone in the administration an email and let them know that these staff in this home had these questions, or we didn't see anybody masking in this home, and just bringing that to your attention so that you can follow up if it's appropriate or not appropriate based on everybody's vaccination status and what your policies are. So that is just our effort to try to support you in your monitoring efforts as well, and to keep everybody safe. So that is all that I have to share with you right now, and I'm going to hand it back over to Jess.
Thanks, Wendy. Appreciate you sharing all of that great information and hopefully shedding some light on the questions. And Angie, there is a really good question about the rates and how that relates to the max in the chat. So I'll let you look at that, and then while you do, I'm going to answer a couple of other questions that have come in, and then turn it back to you to answer that. So one of the questions that, oh, go ahead.
I was going to say, I did respond to that, just asking her if she could send me the link she's looking at, and I gave her my email address, and I can try to walk her through that.
Thank you, appreciate that.
Thanks.
So one of the questions that came in was regarding breakthrough cases of individuals who had been vaccinated. And there's some really good information on the CDC's website related to this, and I thought I should share it. I think it speaks volumes about the effectiveness of the vaccine, and that is, and then I'll post the link in the chat for those who are interested in learning more. So there, as of August 2nd, more than 164 million vaccinated Americans and right now, as of that date, there have been 7,525 hospitalized or fatal cases reported to the CDC. So one thing that's important to know about that is that they are tracking holistically everyone who's been vaccinated and what their health outcomes are. So they started that in an effort to make sure that they were gathering all of the right data. So it can break down further, but it's important to know that of those 7,525 individuals who had those breakthrough infections that were severe, age 65 and older was 74%. Total deaths was 1,507. So of the 164 million individuals who've been vaccinated, that is 1,507 deaths. 316 of those deaths, 21%, among vaccinated individuals were not related to COVID-19. So hopefully that makes sense. They're tracking this information and trying to give a full picture. So I will shoot the link into the chat that has that really helpful information to show the value of vaccination in protecting all of us. And the other thing that I wanted to answer was regarding the extension, possible extension of remote monitoring into September. And so we will be within the next week, because I know everybody needs to make plans for the next month, so probably closer to in the next few days, posting information and updates related to the extension of remote monitoring. As the surge continues of the Delta variant in Missouri, it's important that we reduce our footprint wherever possible. We're not delivering hands-on direct care services to individuals. We want to distance as much as possible. In that same realm, we want to make sure that people are still being seen and monitored. And so there will be some additional information about that extension of remote monitoring into September regarding if someone hasn't been seen in a certain length of time in person, that we want that monitoring visit to happen in person. And of course, there are always those caveats that have always been in special situations that have always been in that guidance, so that'll continue to be in there. But expect that information to come out in the next few days, and we will continue into remote monitoring in September to reduce that footprint, hopefully reduce the spread, but also at the same time include some information to make sure that people are being seen on a regular basis to ensure the safety. So with that, there's another topic I wanted to talk about that is going on in the midst of a pandemic crisis, and that is the workforce crisis and how it has affected the individuals that we serve and the crisis that they are experiencing. And so we wanted to share this information with you in an effort to ensure that there was an understanding among everyone who works with us that this is a statewide issue that we are currently experiencing related to workforce crisis. And I think in the past, when we've had individuals who we serve who have been in a crisis situation, really being defined as there is no provider available to serve them, that it has been kind of a one-off situation, and we've always been able to really find a solution by working through a regional office and with local, providers or state network providers to find a solution. And that hasn't been the case in recent months. The COVID pandemic has increased the COVID workforce, or the DSP workforce crisis. It's put an additional strain on it. And so what we're seeing are crisis issues that we are not able to resolve, which is the worst possible outcome. We continue to try to resolve them. And then there are things at a larger systematic level that we are working with the administration to improve and move forward on what we can do for individuals and providers to make sure that this is not happening. But just to give you a picture of what is currently going on, so this is as of July 30th, we had 61 individuals in crisis statewide, meaning that those are individuals that we cannot find services for, and they are in crisis and have high behaviors and need somewhere to go. 21 of those individuals as of that date were in the hospital, 7 were in a jail, 8 were at their home in an unsafe situation, 20 were with a provider, and the provider had given notice, and that notice had expired, but that provider was continuing to serve them, possibly at the detriment of staff working extreme overtime and things like that. So the couple of just cases, just to kind of show you that this is something that's happening statewide. And so one case is we have a 16-year-old who has been for now 46 days in an emergency department. That is the placement option with support from hospital staff. And that comes after discharge from a crisis respite facility due to multiple elopements and episodes of violence resulting in injury. This individual has been in the consumer referral database for over 5 months, and there are 3 providers who have completed meet and greets, who are currently, we are awaiting response from. They're trying to find staff is what we're hearing. The second example I have is a 20-year-old individual who has been hospitalized since March of this year due to aggressive behaviors and the physical size of this individual. In the hospital, he has often occupied a 10-bed unit by himself with 3-to-1 staffing ratio. This individual is in the consumer referral database and on the waiting list for multiple crisis respite programs. So as I talk this through, it is just something that we wanted to create an awareness, because I think there is an expectation of an immediate solution being available. And I don't think, or maybe that this is a regional issue, and we just wanted to let everyone know that we are well aware of this growing crisis due to the workforce shortage, and it's something that we're actively working on solutions for, and that really is the bad news that I have to share. But bringing awareness, I think, is just something that is important. So we appreciate you taking the time to listen to that information and all the help that all of the providers are doing in taking in crisis clients, because those numbers are higher, and then they go down, and then they go back up again, because we have providers who are moving mountains to take them in if possible. So appreciate everything that's being done out there in the community. And with that, I am going to turn it over to Station MD so that they can provide updates to you. So I will turn it over to our friends at Station MD.
Thanks, Jess. Can you guys hear me okay?
Yes, we can.
Great, thanks. So, yeah, thank you for the updates. Aside from reiterating everything that has been said regarding keeping vigilant and masking, I guess I would just acknowledge that, everyone has this COVID fatigue, and we're hoping to be out of the woods now, but I think it is absolutely critical that we stay vigilant with the things that we already know about regarding the masking, getting vaccinated. I think, thanks for that information, Jess. I think it's important to emphasize that nothing is 100%, but the vaccination will definitely prevent most of the times any type of serious illness. And I think that's the data that you were alluding to. So I would just implore people to really keep on top of that. And we at Station MD really want to thank the department. I mean, the department has been very proactive in keeping this population and support staff safe. And in that sense, what I would just remind everyone that we are available as a resource 24 hours a day, 7 days a week, to assist in any medical question, concern that you may have. I think now more than ever, especially as you've seen the cases surge and hospitalizations are increasing and ICU beds are being occupied, anything that we can continue to do to keep people out of the system if they don't need to be is important. And it's important for the doctors and nurses and staff that are working that are already overwhelmed, but also to keep individuals and support staff safe. We also want to continue to administer regular care to individuals, address their medical concerns, and not let things, just go by the wayside. So we are there. I just, again, for anyone that, I hope I don't sound like a broken record, but we are there 24 hours a day to answer your medical questions. The department's been amazing at providing this service to you, to anyone that's on the waiver services. So, yeah, great. There's I think some information about the contact numbers is on the website. I know I've gotten some questions. I just wanted to real quickly address that we seem to get a lot of at Station MD is that if you're vaccinated, can you still spread the virus? And again, a lot of this is a moving target and what's out there, but the CDC has kind of mandated that, that you do need to still mask up. You still, there is a chance of spreading the virus. Now, that's kind of also a moving target. Some states and some municipalities are readopting masking rules indoors. But, my personal opinion, and I wouldn't preach, but I think that anything you can do that can protect yourself and others, it's just a mask. And I think that's something that we really need to take to heart, considering the population that we serve are more vulnerable to the virus. And the other question I get a lot, which just it may not be clear to everyone, is that when you get tested for COVID, are they testing for the Delta variant? The testing for the specific variants are genomic testing. So in a general test, you don't get, well, you have COVID alpha or COVID delta. So I just wanted to clarify that with other people. And the last question that I don't have a specific answer for, but yeah, there are other variants out there that are, purportedly more lethal, more virulent in certain areas. But I can tell you that the more aggressive we get with vaccinations, of keeping the spread of this specific virus, reduces the chance for that virus to mutate to others. Now, it's not 100%, but again, everything that you heard and you've probably been hearing for about the last 2 years or so almost now, unfortunately, we're tired of it, but still makes sense. Masking, hand washing, social distancing whenever possible, and just really trying to stay out of the healthcare system whenever possible. So that's all I had, unless anyone has any specific questions for me.
Dr. Trivedi, I think there was a question in the chat related to working in offices where there were cubicles, and would there be any advantage gained by, in that indoor space, wearing a face mask while in the cubicle alone, in addition to the protocols of masking up in the general areas of the office?
Yeah, no, that's a great question, and I wish I had a specific answer. I would tell you that my reflexive answer is yeah. I think it wouldn't hurt to wear a mask while you're indoors in general. But a lot of this is based on things that are variables, like what is the circulation like? How far is a cubicle from someone else? What are the vaccination rates in your office? So that being said, since some of these are unknown, I would recommend wearing a mask. I can tell you when I work in the hospital, whether I'm in the middle of the ER or next to a patient's bed, or I'm, in a cubicle type area, I keep my mask on. It's really only when I'm isolated in my own room and area where I take it off. But again, that's a hospital setting. So if you're comfortable wearing it and it's okay, that in sense of you may be close to someone, I would say it wouldn't hurt.
Great, thank you. I appreciate you addressing that. Any other questions while we have Dr. Trivedi here? Okay, well, I want to thank all of our panelists and just really appreciate everyone's time listening today and the great questions that came in and engagement, and we look forward to talking to you soon. Have a wonderful weekend.